In the last TechToTransform podcast of 2021, Mantis MD Eleanor Willock talks to Liam Cahill, National Advisor on Health and Social Care and an expert in digital organisational change. They discuss the digital NHS mindset, whether ICS regulation will solve the innovation gap, and the exact point at which citizen data should become patient data. Take a listen.
Hi everybody and welcome to the Mantis PR TechToTransform podcast. I'm absolutely delighted to have a special guest today. I want to introduce you to Liam Cahill. Hi Liam.
Hello, great to be here.
Thanks for coming on. You're our last guest before Christmas.
Sort of a last minute Christmas present maybe.
Exactly. I mean you're number 9 in the advent calendar door, aren't you? It's Thursday the 9th of December. So before we start, perhaps you could tell me a little bit about who you are and what you do.
Yeah, sure. So I suppose it's a bit of a long and winding road, really, but I spent 17 years in the NHS. I was consulting around the NHS for a number of years and then ended up taking on what was back in 2010, a major program around cost efficiencies, which kind of grew and grew and grew to the point where we ended up basically working as an independent social enterprise that span out of the NHS, working with 97% of the commissioners in England, most of the other devolved nations, and more or less writing most of the prescribing medicines and prescribing policy that was happening in all different kinds of areas. Very proud at the time that I think at this particular time, sort of on a fag packet, we enabled the NHS to help save a couple of billion, and that the organisation is still going strong. Now what I do is I work in two areas. I work especially with the NHS and frontline providers. So I am on and off an advisor for NHS England Improvement around digitising their community programme. I led some work with X at the beginning of COVID. I work very closely with a number of frontline providers in community care. So the community service providers, not the other different definitions of community. And I run an accelerator that basically helps them to kind of take their digital journey and do their digital mindset. I suppose lastly, I also have, since kind of setting up my current organization, I have mentored a whole range of health tech companies, big and small, from sort of C to sort of Series A and B. And also I have advised some venture companies and worked with those. So I like to think that I'm right on the intersection between health and social care, and you know, trying to sort of help to see how we can get the system close to technology and technology close to the system, really.
You sound like the perfect guest to round off what has been a very interesting year for health and social care, and that kind of plays quite into the first question I wanted to ask you, which is obviously there has been some huge announcements in our area, hasn't there, in the past couple of weeks, and one of them has been about the new involvement with NHS England rolling NHS DNX inside its organisation. And I was wanting to know, I mean, I think it's such a fantastic move in lots of ways, because it really shows how important digital and digital first is going to be to the NHS and hopefully to social care as things move closer together. What differences are you thinking it's going to make, and where should the first focus be?
So I think firstly, I suppose, to zoom out, it is a massive change, and it does to a certain degree make sense. But I think we need to probably acknowledge that the NHS is probably the first institution to continuously commit to design thinking in their consistent political divergence and convergence over a number of years. Yeah. Like realistically, I think, you know, there are a lot of good things in this, but I think actually what we're talking about to a certain degree is that the NHS is that national institutions really struggle, I suppose, in terms of they split up, and this also counts locally as well, but they split up into smaller entities, then it's fragmented and varied, and they struggle to be able to, you know, they've got duplication of work, and then they all come together and then they slow down and they struggle because they're consolidative and they can't move as quick, and then they do it again. So I think, you know, whether that's a natural cycle or not, I think that's probably the first thing, that right, realistically we've had a period of the NHS kind of splitting into different entities, and now we're pulling it back into the center. I've got, I suppose, a non-contextual and a contextual answer, Eleanor. Like, I think the first one is look, there is a high risk, and there's a high risk because this has always been the case, that we're going to see a period of entrenched navel gazing. And I suppose realistically, you know, like national bodies do fall foul of this, and I've seen it firsthand. You know, obviously they're very politically oriented, and the politics around this has changed as well in terms of what the new legislation says about the national institutes and the proximity towards politics. My concern is that it's actually there's a risk that we're in contrast to, that we're sort of contradicting the, I suppose, the area of change that we're seeing in the Harvard Business Review, and that the major sort of thinkers are saying around how organizations should be focused. So my concern is that whilst I think sentimentally it's a good idea and it makes sense to reduce duplication, one of the problems could be if we start to see that they start to kind of try and spend loads of time consolidating about how they fix different topics. Like, I think, like if we take, for example, some of the major themes you want to see, so carbon reduction and like digital improvement and estates and place-based care, these are all theoretically aligned, but actually they're going to have to do a lot of thinking about how they design teams. Is it in the context? Where, is it technology teams that suffuse into this, or is it tech first? And I suppose my initial concern is that, one, it's that at the time when the Harvard Business Review and leading thinkers are saying that we need to start disaggregating organizations into more fluid micro enterprises, the NHS is going to potentially risk creating the biggest organization chart that we've seen. I think in terms of process as well, like I suppose NHSX has really come to the fore in terms of using design thinking to center its methodology. And I think it's been really good, potentially sometimes too much when they're trying to hit systems problems. But the NHS England structure is often around systems thinking. Now, ideally, what we'd like to see is a blend of these two things that could come through. And my concern is that one will start to dominate based on politics, and that they will miss the opportunity to blend, being able to think innovatively and connected to the edges versus thinking in the center and trying to presuppose all problems. So I suppose that's, and I think this is something that all large organizations are having to contend with, and I just really hope that they will really think about how they do this. I'm sure a lot of consultancies are going to be coming in to help them with the answer on this, but realistically, I don't see how we're not going to have 6 to 9 months of distracting stuff at a critical time in the NHS. So I just hope that it won't distract, really.
So 2 questions from your answer then. Firstly, where is the connect at the moment between NHS DNX and the average NHS employee? Now, what I'm trying to say by that is the general public, our friends and family, think of the NHS and they don't think of somebody who works for D or X. They don't think of that aspect at all. But does the community nurse or the consultant or the hospital receptionist think of NHS Digital and NHSX as in any way connected to what they do?
Well, the short answer is no. The longer answer is that, nationally NHS, all of these different topics, there's very different ways that things are being done. So if, for example, we look at sustainability, staff who are working in sustainability roles locally might have quite a good connection to individual teams. It might be that tech staff and digital staff in organizations are quite connected to certain parts of NHSX or NHSEI who are doing digital things. Just to say, I'll go give a particular example, sort of a shout out to the Aging Well and Community Digitization team in NHSEI, who I think are absolutely fantastic, and they are constantly on Twitter. They're doing promotion around things, they're gathering and sharing, disseminating information, and I can see that they've got such a massive following of nurses, for example, who are really interested in this. That's a great example. But in terms of NHSD, no, not really. I think there's a lot. I think if you ask the average person what NHS Digital did, they'd say digital with a question mark on the end. They wouldn't really know, and I think that's part of the problem.
So like me, do you think that there is work to be done in terms of public policy and communications about their critical role in what's happening to our health and social care system?
Well, yes and no. Like, I think it would be impossible for every member of staff to have a close connection to a national entity. Like, I'm not for, senior org charts, I suppose. But I think, to be honest, it's not necessarily about what, but how, to be totally honest. I think the how should be that actually, if we take the NHS national institutions as a leadership body rather than a coming up with the answer and sending it down to everybody, and we actually take, again, more contemporary thinking, then ideally, if their activities are entirely centric around enabling, then that can be achieved a lot more. And yes, that's possible. But at the end of the day, they don't have the capacity to be able to work with everybody in that kind of way, really. So I think we probably need to, there's a balance, I suppose, is a bit of an answer, really.
I think you mentioned consultants earlier, and this was going to be my second point. I think that the concept of consultancy into the public sector gets an extremely bad rap, and it should be more of a healthy relationship externally and internally, that consultants are a good thing for change. How do you think that is going to affect the impact of this roll up from NHS D into NHS England?
So, okay, like there's good and bad forms of consultancy, right? And there are certain consultancy organizations that have really great people who do really great work. The problem with consultancy, and I think if we look at the history of consultancy, what we would have is some very well paid, very interesting thought leaders who would come and do stuff, and that would get translated down into repeatable elements that they would try and crowbar into their clients to be able to make sure that they could standardize offerings towards clients, right? So effectively, all that we would be doing is we would be kind of offshoring strategic leadership and decision making that actually needs to move forward. So I think there's absolutely, arguably I'm a consultant, but I think what we need to do is we need to make sure that consultancy is oriented so it's fitting within the meaning of what's going on, right? And we need to basically not have graduates who are basically being oversold using spreadsheets, and that model's going to die. I don't think consultancy has a future in that sense. So if, for example, we take consultancy in the form of them coming in to do really good design thinking work and trying to use these kind of methodologies to be able to support the system, then it's less about what the thought leaders in those consultancies are doing and more about making sure that they can bring in extra resource to be able to take people through a process which is endorsed. So I think it's about the how they do consultancy and how they engage. That said, for systems issues, I think it's also like, you probably do need an element of that to be able to kind of do stakeholder engagement and mapping. But I think it's just around making sure that those who are employing consultants aren't just going, this person knows all the answers and can you come in and tell the answers? And to be honest, I've been foul of people I haven't accepted it, but I've had people who've kind of come to me and said, loads about this, can you just write down the answer for us? So, and generally I've had to push back and make sure that it's meaningful, really.
Yeah, okay. I think that's a very smart point. I feel like consultant, like PR consultancies, can't just go in and tell our clients exactly what to do. It needs to be that we learn together and help them understand the direction of travel and how that experience can be repeatable to have better impact later on. And the best working relationships always get to the conclusions together, don't they?
Yeah.
So the other big issue that is facing our industry at the moment is the direction of travel for ICS. And we've been thinking and writing a lot about this at Mantis for our clients recently, and it's such a huge topic. And I did see a fantastic example given by the NHS on LinkedIn the other day, where they gave a very clear sort of pathway through the ICS journey for a particular trust and how it was working with its local authority to pass on various aspects of care. And it really struck me that I feel like in the journeys for my clients' customers that we need to work for, we need to find the smaller connecting stories that are really working and show how they could eventually be connected together with other integrated care to make that bigger journey, sort of connecting the links in the chain, rather than thinking of an A to Z and trying to connect it all the way through to start off with. Where do you see the direction of ICS at the moment, and how government and policy are going to work together to make it happen?
Okay, so isn't the answer to every question is it's complex, right? Particularly in health and social care. So I think firstly, look, the Lansley reforms were a bit of a dog's dinner, and because of Brexit, we got stuck with a system that we couldn't legislatively reform. There's absolutely need for legislative reform, and we need to move in the direction of bringing health and social care together. We need to have entities working together, and we need to stop fragmentation at a local level. So absolutely, what we had at the moment was a legacy. We continue to have a legacy set of policy, funding, governance workarounds that need to be fixed. So without a shadow of a doubt, it's absolutely something that needs to happen. Secondly, I think in terms of the aligned PCN formation, it's a good first step. Although to be honest, COVID has kind of meant that for those entities that it's been a bit slower. I've got concerns. I'm going to try and make sure I speak positively on something. I've got some concerns, but I think there's also opportunity. So my concern is that I think a lot of the narrative at the moment is increasingly consolidative in its mindset, right? Now, realistically, let's just place where we are at the moment. If we look at the long-term plan, we have the biggest need for system transformation that we've ever had. The economic necessities are all there. We are entering, or we're very much in the process of entering the fourth industrial revolution, the second machine age. We are entering an entirely new stage for society. And what we desperately need is disruption and innovation to happen. I've worked with CCGs and I've worked with some wonderful people. I'm not going to take away from any of their work, but actually what I've seen in working with some of these institutions is that they are not innovative. And a lot of the entities that are going to be feeding into these consolidated organizations are not naturally innovative. Now, as an example, let's take digital, right? So there is increasingly a bit of a mindset that the ICS will manage digital for the area. And that makes logical sense. But the problem is that there's a real risk that this is at the cost of innovation and disruption. And we've learned from the outside world that big institutions don't innovate when they work in a holistic way. And so I think we really need to try and look at making sure that the fabric isn't that there's just these big chunks of stuff that does care and decides on things, but actually we've got smaller petri dishes where we can make the disruption happen. Because actually if we take the Vanguard models, and I suppose I'm slightly concerned that realistically what will happen is this will be massively distracting, as it always is. Like if we just look at, like we had 2 years where the Landsley reforms, the system was just trying to get its ducks in order, right? And we're going to see this again at one of the most critical times of the NHS. And so realistically, they're going to go into safe zone, which is let's make decisions as quickly as possible and get things in place. And then we take the love child of acutes and commissioning bodies who are kind of dominating this, who work in a very similar kind of way. Yes, it's an antidote to unmanageable fragmentation and variation. I can see the upside, but I've got a real concern about innovation and how actually we're going to be able to small sample, iterate and test things in these big systems, really. And I'm seeing this playing out now, that organizations who have more innovative ideas, for example, for the Unified Tech Fund, just aren't getting airtime because they're trying to do major system things, understandably, that, for example, address elective recovery crisis. So if I could just add one more point, I suppose, about how these organizations orient themselves as well, because I think one of the biggest opportunities that we have is, you mentioned user-centered design, is that we try and avoid this being tokenistic. So what we could end up with is you've got a group of people who sit there, they presuppose the solutions and they say, let's have a product. And what we'll do is we'll co-design it or co-produce it with a patient, right? That's already a massive presupposition in the chain. We've got a national body who says they should be doing these things, a local entity saying that this is what we should be doing, and then go and prove how it should be designed. That means that we're not really getting user-centered design and design thinking because we're not integrating it into our organization. And to be honest, this is part of the exec program that I run to try and take on some of the status quo ways of working that they do, because quite often, if we still have senior layers who make decisions and then ask for it to be proven, we've already entirely undermined the design thinking approach that we want to see in user-centered design. So this needs to span not just projects, but the dominant thinking and power in these organizations, and it needs to be centric around this. If we don't take advantage of this opportunity, then it's going to be tokenistic, and we're going to see tokenism like we've seen time and again in the NHS. So a very long answer, but I think there's unpacking this. There's so many different areas that where there's opportunity and concern, really.
So the legislation should be more about a mandate to innovate.
I think we should see a model. I think we should see proof of innovation. Like if I take East London as an example, like East London is an area that I've got a lot of faith in because the East London Trust has Care City. Care City is a subsidiary entity that works as a social enterprise. A really exciting organisation because they have a petri dish to be able to try new models and feed it into the system without waiting for the big part of the organisation to do this. we need examples like this at all local levels, where we've got skunk works, we've got ways that we're trying things and feeding it through to be able to scale locally that can accept in a well-governed way a bit more risk. And this might be smaller providers and organizations like social enterprise if they have them. It might be other different kinds. But like one of the questions, and I'm working with NHSEI at the moment to kind of ask this as some of the regions and the ICSs are just around like, well, what are you utilizing locally around innovation, for example, in community to make this happen, really? Because we saw a lot of innovation with the vanguards, and that was a great exercise. But effectively, we go exercise over, copy and paste the models, stick them in and deploy them.
Yeah.
We're missing the point of why, one of the reasons why the vanguards were successful, which is that they were so connected and experimental, you know?
Well, that connection and collaboration is something that in theory, our tech consultancies and suppliers could be leading on by helping the organizations find each other in a way.
Oh, it's chicken and egg, to be honest, because consultancies have to respond to the tender they've been asked to do. Now, I've never seen a tender in the NHS that says, come and challenge our leadership model and our board level thinking about how we're in, and maybe I've just missed them, but you know, like I have frontline providers who bring me in to do exactly this, but actually come and actually see in what ways are we undermining the model that we're actually advocating to our staff downwards, you know, because at the moment, all of the things that I see that are coming out are, we want to reform a service and we want to be that specific service or that specific product or virtualization or asynchronization to fit this particular thing. That's already set up by presupposition, quite a significant amount. So like it needs to go a layer up, and we need to basically be training our executives and our leaders across the NHS to understand that we have to think differently and that this needs to be ingrained in their boards.
This is a bit of an aside, but have you ever done a pitch where you've gone in and challenged the status quo to that level, or challenged the thinking to that level and won their attention?
Yeah, that's like before I set up my accelerator, that's exactly what my consultancy did. I said, I only work with, so I would go in, I'd speak to the leadership team, I'd sit down with them, I'd say, look, this is the reason that your organization is going to fail at digital. And it's not to do with the technology you're selecting, it's to do with all of these things that you're doing. In the leadership course that I'm going to be doing, I have 10 chief execs and finance directors who are going to be spending a year with me starting to undo the status quo to work out why this is the case. And this was based off me going in, and to be honest, I was like massive imposter syndrome when I was doing it, but going in and saying, look, you're desperate for digital. I'm going to tell you the things that you guys should actually be focusing on so you don't undermine it, you know. And I could spend 45 minutes talking to you, Eleanor, about how it plays out, but this is exactly, and so the frontline providers that I've been brought in to do, it's been about trying to start grassroots movements and enablement and empowerment and trying to take it away from the center and trying to change the way that they think. And it really challenges leaders and boards, because it means they have to immerse themselves in complexity and the acceptance that they can't predict everything, and that everything is not predictable and mechanical in nature, and that human change is very different, and that we need to have a navigational approach rather than a precision and planning approach, you know. And this really challenges it, because there's always those leaders, particularly later in their career, who say, well, it's always been done like this, why would we do it differently? Like, what's the evidence that proves that experimenting works? Well, the evidence is that the most valuable companies in the world use this day to day to be successful, right? But in the NHS, you know, often they say, well, can you give me the precision and precise answer that tells me? So my work over the last sort of 4 years has been trying to help develop some of those examples and models so other leaders can see that it is possible and that it is very sensible to do, really. So, yeah.
Now, not taking away from your role or my role, but should tech vendors be introducing themselves to the NHS in the way that you would introduce your offering, rather than saying, here's our product or service, it's better than the one you've got, this is problems it can solve? Should they be talking more on that level about how to change the way innovation is done, and their product or service be one of the answers? So what I'm saying is, would tech firms be taken more seriously if they talked on that level of consultancy rather than just about their tech?
So, okay, I suppose I could say yes. I could say you could do that, but realistically, I know so many tech companies across the industry, right? You know, including some of the bigger ones. Like I'm not going to, like some of the really big suppliers that work with the NHS still do not have, like, it's very easy for me to say yes, because I've spent years in the nuances and complexity of a very complex system, and so I have the ability to do this. Often when I work with tech companies, they don't necessarily even understand the differences between the parts, and they have different commissioning models and who decides about what. So I could say yes. And do you know what? If they've got that level of understanding and insight within their organizations, then yes. But the problem could be is they could try and bring disruption and not get that, for example, those leaders they're talking to, that they're absolutely missing the point. Because realistically, you know, the 101 of sales and marketing, right, is you've got to understand your customer and what their wants and needs are. I, like a massive diva, went in and said, look, I will only work with you if you share this philosophy, but I can tell you certain things, you know, and I was willing to turn down 10 organizations to find the right one, because this is a mission. It's a social mission for me.
Okay.
As a consultancy, as a tech company, consultancy company, I don't think they necessarily have that orientation. I would love it if they did and they had that knowledge and orientation. But realistically, if you're on a burn rate and you need to get a contract before your next round, it would be highly inappropriate for me to say, bring your pirate towards the NHS and try and say all of this stuff if you don't truly understand it. And to be honest, if you do, then you like the people in tech companies who genuinely understand the NHS, they tend to make headway because they understand the NHS, right? Right. Yeah.
Yeah, I agree with you there. Okay, so just looking through my list of questions, because we've got only limited time, sadly, before you have to go back into your door number 9, and I have to open door number 10 on my one of the questions I had is in terms of the digital mindset, what we sort of alluded to it earlier, but what more can health and social care to be doing to support and train its workforce? So for example, are we still at grassroots level? Obviously, things like smartphones and tablets are widespread for consumers. One of the, you know, really dry, crusty angles that I try and avoid putting in any of our client messaging is the angle about the consumerization of IT and business services, particularly for local government. It's a bit of a dead duck. But when it comes to digital through the front line, should the NHS and local authorities be looking more into how digital their frontline staff can be? Like, should the job descriptions be altered for care workers? Should there be a level of digital literacy, for example?
Oh, you said the word job descriptions. I'm going to have to not go on a tangent on that. I'm against job descriptions because I think it's reductionist and it forces people into roles rather than being human beings. And I think actually, like, realistically, the biggest thing that we need to do, and I don't want to take a shot at some of the national policy, particularly since I work with these organisations, but I've got a real concern that we still have an orientation that the training and that the support we provide for personal development is around giving people training programs about how to do stuff. So digital literacy as a concept, right? Literacy as a concept, right? If we take apart what literacy means, it means learning to read something, right? Now, at the end of the day, what we don't really need to do, we do need to do it. We need to train people to use systems, but actually we're going into the next industrial revolution, right? And what we need to do instead is to be able to train people to develop their, I hesitate to use the term, their softer skills, right? What we need to help them to be innovating more and collaborating and ideating and knowing how to connect with meaning and to develop, you know, to be weaponizing curiosity and asking questions. These are the things that we need to have in organizations. And right now, most orientation around this goes in towards training people to be able to do stuff. So keeping them in the box that they're in at the moment, right? Rather than learned experiences, because we need, like, we talk all the time about the fact that we want, like, organizations say it all the time. They just go, we're not getting any innovative ideas from our front line, right? It's because they don't practice what they preach, and because at the end of the day, to give learned experiences, we need to give people a chance to safely fail and to try things and to iterate. And Pixar has a really great term for this, which is basically ugly babies, right? Because what they found is that people were having really early ideas in their organization, and they weren't fully formed, and they weren't nurtured, and they hadn't had a chance to grow and evolve, and they just got crushed, and then people didn't want to do it again, right? We see this all the time in the system. People try and innovate once, they have a horrible experience because of gateways and processes and lack of understanding about how to do things, right? And so basically they don't end up getting to it, and they have a horrible experience and they don't do it again. So what we need to do is we need to create nurturing environments for these ugly babies and to be able to help people to bring ideas, because digital is not about being able to use a system. It's about people being able to solve problems in real times with tools and technologies, and having the right systems that allows them to do that, the right culture, the right organizational structure that doesn't get in the way, and again, the right skills and experiences that allows them to internalize how to do this. This is a major change away from some of the things that we're telling people to do. And we're not going to succeed at being digital and having a digital workforce unless we really start to think differently about this stuff. One thing I would say, though, is, because you mentioned frontline, is I think that we absolutely have a massive missed opportunity in the workforce. Because if I look at the back offices of organizations I work with, who often don't have any of these skills in many cases, and the front line, a lot of care is actually in the front line about how it promotes people having these skills. And quite often you speak to a group of nurses and they go, oh yeah, I'm not digital. And what I've seen in working with some of these frontline services is when they realize they can solve problems for patients in real time using things and come up with solutions, and then you go, this is digital. It's not about you being able to use that massive EPR. It's about you being able to think and innovate and disrupt a way of working and create a new one. This is a digital mindset. And they go, oh, that's great. We've already got these skills because we do this day to day in terms of solving. So we have a massive untapped asset in our workforce. And the problem is that we're communicating it incorrectly and not helping frontline staff to see that actually digital is not what they think it is, and it's something more different. So we're not doing enough. We can do so much more. And I think if we can really tap into that, we could see such a revolution. When I see frontline services, the penny drop and they realize what this means and what they can achieve, suddenly you don't need to train them on digital. You don't need to sell digital to them. They get it and they want more and more and more. We need to create that environment, because that is what we need in the NHS, and that's where innovation is going to come from, really. So off my pedestal for the moment, but yes.
No, not at all. It obviously, being as you're completely surrounded by Star Wars memorabilia, I was thinking of Yoda and either do or do not. There is no try, but it actually seems like completely the opposite of that with digital. That
yeah, totally.
I don't think Yoda would last 5 minutes in the NHS. I mean, obviously he's 909 years old, so hopefully he has had some NHS care. But
I actually use Yoda in my slides, and I use his quote, "Luminous beings we are, not this crude matter."
I am, like you, quite a large Star Wars fan. I'll tell you a secret. When I was at university, I did classical studies, and I wanted to do my final year dissertation on the parallels between the Homeric epics and the Star Wars trilogy.
Ooh.
And I wasn't allowed to, and it's one of my deepest regrets. Maybe that will be something I can consider during lockdown 27.
That's what you've got to do. I'd actually say, like, I know this sounds like massive overthinking, but I use Lego Star Wars so much in all of my like visual cartoon like decks that I'm using for presentations, and there's actually real meaning in it, because there's two things that come out from Lego Star Wars, which is one, we can, if we have building blocks, we can create stuff, right? You know, that's the sentiment of Lego. You can build anything if you know that you've got the right building blocks. But actually, quite often I kind of use the Empire to describe the status quo system, and the Rebel Alliance to kind of describe this group of misfits who managed to innovate and come up with answers. So I'm all over Star Wars and Legos as a I suppose as a an analogy for how we can reform care.
I've got to ask you then.
More Star Wars.
Episodes 1 to 4. Which character do you most identify with?
Oh, I'm definitely Jar Jar Binks, 100%. No.
Probably the greatest innovator in the galaxy.
That's a good question. I'm going to think deeply on this before answering, I think.
Okay, my second random question. Somebody makes you Christmas dinner and there's something that's not on your plate, what is it that you would miss so much from your Christmas dinner that you'd stand up and leave in disgust?
I'd say that's a reductionist question. The whole is greater than the sum of the parts. But any individual piece that is missing, whether it be Brussels sprouts or carrots or anything like that, if it was missing, then it wouldn't be a Christmas dinner, right? My answer is wood for the trees.
Oh,
I know. We're getting philosophical today, aren't we?
We are. So let's get even more philosophical and nefarious.
Okay.
About interoperability.
Yeah.
Is it a bit like innovation and digital, one of those words that not enough people understand the real true meaning of?
Yeah, I'd say most of the technological concepts that we have at the moment are probably could be summarized by exactly those words. I talk, instead of, I suppose, interoperability, I talk about ecosystemization, right? What I say is that effectively our organization is digital, our technology is digital, and what we need to make sure is that things are in the same place and that we're able to connect as many parts as possible. Often, I think when we talk about interoperability, people go, "Oh yeah, you mean like the data going into the Leica record or something like that." Interoperability is we talk about interoperability, but you tell someone who uses Zapier day to day to string parts of their business together, or uses, I don't know, like Power Automate to make things happen, and to be, or who builds an API as a service. Like, I think we do have a massive disconnect around what interoperability actually enables. But to be totally honest, I think we're limited. And actually, I'm going to go again. This is a challenge because we went off down a rabbit hole and didn't discuss around what NHS England and NHS Improvement should be doing. Interoperability should be a building block oriented approach to things, and what we need is more building blocks which have easy ways to be able to connect things together to solve problems. The answer to the NHS is, as technology progresses, we have more fluid functional interoperability between systems. The problem is that we are so stuck in duopolistic and monopolistic sort of wrangling with major system suppliers that actually we're not able to functionally provide this. And one of the things that I'd really like to see the national bodies do, and I know that they're going in this direction, is to start taking away a bit of a disaggregation of data, my data and my organization's data. Like, I work with frontline providers who are trying to get access to their data so they can use it. And you would think they go begging, they get charged ridiculous amounts of money to be able to do it because they want to solve a problem for their patients.
Okay.
And it's impossible. And realistically, they are missing I had a meeting yesterday with a frontline community provider who was trying to see if they can improve their referrals and use robot process automation. Because they don't have the basic building blocks within a major system who I won't name, what that effectively means for them is they don't have the ability to trigger things. And if they can't trigger it, they can't start automations. There's maybe big workarounds that they could do, but they don't have this basic level of interoperability that allows them to take advantage of a massive opportunity. So I think we need to change. I think we need to have a slightly higher level view around what we're talking about. And to me, what I spend a lot of time talking about is, and I use Microsoft 365 as a good example around, what about if we have a range of things where we can connect two things together and it becomes better than the first thing, the two individual things that we have. I think, again, we need to be able to make sure that the narrative helps people understand what it can be. But actually, situationally at the moment, interoperability is quite limited towards exactly the things that I was describing before, like trying really hard to get something out of a system which is business critical. So, and this needs to be addressed.
It's out, I mean, the way you describe it, I can really feel your your emotion about the fact that data seems to be almost held to ransom. It's counterproductive sometimes when a provider has the data that the customer needs to become interoperable, and there are issues whereby it can't be, and that must be immensely frustrating. I think I did have plans to ask you about whether what I see is the interoperability dream, which is that all public services have access to the same data to help people at the same time. The example that I give very frequently is about how if the fire services are going to a call out and they don't know that there's oxygen in the house when they turn up, whereas if they had the same records as the local authority do, and they knew that there was somebody in the house who had oxygen, and if they also knew there was somebody in the house who had mental health issues, their call out would be possibly a different response. Do you see what I mean?
Yes.
How can we get to this level without it being a danger to I guess data security? Also, there's that fine line, isn't there, between the public feeling threatened about all this data being available to all these different services and the public being enabled, society being enabled.
So
we could probably do another podcast.
Oh yeah, we could spend an hour on this, but let me give you my take on this, right? So firstly, I think if we're thinking about data, like especially as we start thinking about health and social care are different kinds of services, right? So I suppose if you say, like, is there a time when we'd see complete interoperability between core public data sets, right? My answer would generally be no, and that we shouldn't, because actually, and I am really into blockchain and the concepts of the next internet of everything as it starts to come through. And I think one of the things that we really struggle on, that we can actually take a lot of learning from in the blockchain field, is around permissions and chains to make sure that we have consistent rules about what can and can't be done. Firstly, this isn't the public sector's data set. This is the citizens' data set. And actually, we're going to see this come through more and more and more. When I start taking, if we take I'm such a fanboy of him, but we take some of the stuff that Eric Topol talks about. There's an amazing podcast actually he did with Genomics England, where he talks about genomic dataship and ownership, which is absolutely wonderful. And with Chris Wrigley, and I would definitely recommend that anybody listens to it after they've finished listening to all your podcasts, of course. Is that it's not their data. And I feel quite passionately that the system's data is my data. It's about my life and my health. And if we start thinking about the context of health and social care, I was asked by an organization, a consultancy, to try and help support them to think through what the next generation of a combined health and social care system would be. Now, realistically, I'm in a care home and I'm taking my medicines. Now, I'm taking my medicines, or I'm not taking my medicines, I'm eating, I'm having trouble swallowing, I'm doing all of this. Now, this is, until it's a clinical intervention, that is not a patient, that is a citizen. And that individual should effectively, their data should only be provided with the system when this is meaningful. I was actually, when I was leading some of the work in NHSX around thinking around medicines, we talked around the what the value of the data would be around care homes and taking, care home round reviews and stuff like that. But realistically, I'm not a subject of the NHS. I'm a consumer of the NHS, and I use it when I need to. Now, effectively, what we need is good permission systems that sit over the layer that talks about the functionality of what we should be able to have. We just go for a clinical interaction, right? My day-to-day life data and my tracking of different things, which we'll be doing as personalized medicine becomes bigger and bigger, becomes part of a day-to-day thing, which is walled for me. It's got a walled garden and it belongs to me. And when I'm engaging with the system and I have a problem, there might be either pseudonymized or genuinely machine learning pseudonymized system data sets that, can extract some of this for research that I might want to grant, access to. There might be different parts of data that I want to give this to, but then I go to hospital, I go to it. And let's say, for example, the NHS asks me, like with blood donations every year, what would you like to share with the services? In the same way that we have a DNR request, and we have some very simplistic forms of this in the NHS. And I would like to have my preferences that maybe I could work through my family about what we want to see. Let me give an example, right? Let's say I've been to a sexual health service and I've had something nasty. This is not a true story. My partner goes in and I go into hospital because I hit my head and I'm unconscious. And suddenly they say, to my partner, could you explain what happened at the sexual health clinic? I'm giving a terrible example here. If my partner's listening, then it's not true. But effectively, there are citizen reasons why I might not want that to be provided. And so effectively, what we need is a more sophisticated permission system that allows us to be able to take my data, citizen data, care data, and health data. And actually, the next layer of things that we need to have is really thinking about permissions, not the data itself, because the data itself is easy. It's about who should have what when. And actually, I think this is where we need to start looking at blockchain and thinking about how we think about data and function and flow, and how we start to think about how we can set these, because actually the technology is all there that can give us this. We just need to move in that direction. So, but we're being held back by the big systems, of course. Yeah.
I really like the swallowing example of the person in the care home, because of course having difficulty swallowing isn't an issue unless it becomes a medical issue. However, if that data was being recorded by the care home or the care provider, that then becomes data that potentially becomes available to companies that can use the issues with swallowing, maybe if we're talking about tablets or different types of food, to develop their product or service based on your issues with swallowing, even though it was never a medical issue until you flagged it as a medical issue. That's a really fresh perspective. I've not ever thought of that.
But this is about choice, and we talk so much in the NHS about choice, but actually this is the I hate to use Boris Johnson's term, but this is the level up of choice. Really, we need to think more in a more sophisticated way about choice, because what we're talking about is complex interactions between people, their carers, social care, potentially healthcare system. And so what we need to be able to do is, in that situation, to be able to say, a carer says to a clinician, I'm slightly worried because they're not eating their food. Maybe they've got the data that says actually that they're having to give sip feeds instead of food because of swallowing issues. And then the person would be able to say, hopefully the person would have the cognition say, would it be possible for us to take this piece of data and to be able to just analyze it so we can actually look at it? So it's not a slice of care, it's real time. Would it be okay to look at your medicines adherence? It might be for old and frail patients that they default to this because actually there's a necessity for the intervention. So we think about different people in stages of their life. But actually, with the right technologies, we can absolutely do this. We can absolutely be able to have this permissionless system. And then if we think about pathways, we think about how we can integrate them. And part of that pathway becomes a request. It's push and pull of permissions and having sophisticated interactions. But actually, if we're generating this data, then we can do this, and it is possible, but we need to make sure that these are linked together. And, you know, that, for example, it might be that people can say, I would like to provide this. You know, there are machine learning things that can effectively take our data and create almost like, I don't know, like the AI, you know, where the AI can take 100 images of people and create a brand new face. We can do that with data now. So actually, we can actually do genuine ML driven or AI driven, I can't remember the exact term off the top of my head. I should know it, but you know, we can do this now, where actually you could have different levels of what data you'd like to give, for example, for research and progress and stuff like that too, and digital twinning and all of these different things. But it's just about sophistication, and we need to move this conversation forward, really. So, yes.
So it's time for my last question. You are speeding on your way to Downing Street in a taxi, it's an Uber, with Sajid Javid. He's got the wine, you've got the cheese. What are you talking about?
Oh, well, what would we not be talking about right now? It's probably a bigger question.
The fact that you're on the way to an illegal party.
Exactly. Why am I on my way to Downing Street? What do they want me for? I'd probably be asking Sajid Javid why I'm in an Uber going to Downing Street. That'd probably be the first question. I'm going to give you a boring answer because, all right, so I'm really anti-sycophancy, so I wouldn't be, you know, I've seen, like, we've had, like, there's actually a DH question, a DH interview question, I think, that says, if you were in a lift with the health secretary, what would you talk about? That's an interview question that the Department of Health does.
Yeah. I thought it was so
no, but it's great. Because actually it's real-time question, right? And I think, you know, like, the realistic, I'd probably just talk about the fact that I'm from Bromsgrove, which is his consistency, and have a chat about Bromsgrove, to be honest, because I don't know, like, I've been to enough things at senior politicians and Matt Hancock and so on, and I've seen the kind of level of, like, oh my God, sycophancy. And I just think we should just treat everyone the same, to be honest. So I'd probably just have a chat about something normal if I could. So, you know, we're all citizens, right? I
think that you're absolutely right. And I think that the Saj would appreciate your normalcy, especially today when he's had a very tough round of interviews about a very challenging subject.
It's been great. I've really enjoyed it, Eleanor.
Well, listen, thank you so much for coming on today. I hope you have a fantastic Christmas. Can you give me a spoiler about which Star Wars Lego is in the stocking for you and your family?
Well, we're actually getting my son a train, one of those moving trains for Christmas. I have not asked for anything, so I might get something soon. But yeah, do you know what? Actually, this Christmas, I think we're just trying to have an environmentally friendly Christmas, and I've actually asked for donations for charity from my family and stuff because I'm just feeling over consumerist, and I'd like to. This is really boring, of course, but like so, yeah.
No,
I like to be honest. I just kind of feel, and my family hates it, but we're just trying to be the change this year. So hopefully, I won't get too much plastic. I think we've got enough plastic at the moment, but yeah, maybe a second-hand Lego set might turn up. Who knows?
Good. Well, I hope it does. Well, listen, thank you ever so much.
No, thanks, Eleanor. I really appreciate the chat.